Thank you, Connor. A new study is showing that cervical cancer is on the rise in the U.S. among Black and white women, one of several cancers that impact the female reproductive organs. Joining us now is Dr. Amanda Ramos. She is a gynecological oncologist with the Hartford Healthcare Cancer Institute at the Hospital of Central Connecticut. Thank you so much for being with us, doctor.
Thank you for having me.
So what are you seeing with your patients, and what is the reason for the increase?
That's a great question. So across the nation, particularly in the South, we are seeing an increased rate of cervical cancers, particularly in more advanced cervical cancers, so cancer that has spread beyond the cervix. It's a little bit unclear as to exactly why this is happening. Anecdotally, I do feel that this is because there's a decrease in the amount of screening for cervical cancer, such as pap smear screening, and I think that COVID may have something to do with this.
So what are the warning signs of cervical cancer, and at what age are women most at risk?
That is a great question. So one of the most common signs of cervical cancer is abnormal bleeding from the vagina. So this could be bleeding between periods, could be really heavy menstrual bleeding, could be periods or bleeding after intercourse, or if you've already gone through menopause, bleeding after you've already gone through these changes. In terms of the ages of women that are affected by cervical cancer, we see a wide range of ages, but it can happen between the ages of 30 and 60.
And what are the type of screenings that best help detect cervical cancer?
So 90% of cervical cancers are caused by the human papillomavirus, HPV. So early vaccination with the HPV vaccine is one of the most important tools that we have in order to prevent cervical cancer. Seeing your gynecologist at least once a year is a good way to detect and prevent cervical cancer, as well as obtaining routine pap smear tests.
All right. Well, thank you so much, doctor, for shedding some light on this. We appreciate you being here.
Thanks for having me.
For more information, you can visit hartfordhealthcare.org/cancer.